Dr. Ellen Horovitz is a licensed and board-certified creative art therapist. She is a professor and director of the Graduate Art Therapy program at Nazareth College of Rochester, New York. She has had over 30 years of experience with various populations. She is a former president and part of the board of directors for the American Art Therapy Association, as well as on the board of directors for the Society for the Arts in Healthcare. Dr. Horovitz completed her Iyengar yoga training to become a registered yoga teacher through the Yoga Alliance, and she is also a member of the International Association of Yoga Therapy. Dr. Horovitz is pioneering the method of integrating yoga into art therapy sessions to aid the healing process. She has been using this method in the Nazareth College Art Therapy Clinic, mainly with clients who have suffered from a stroke.
I did not use yoga with my clients until I was properly trained. I first started working with students and with friends, and then eventually moved to clients when I felt sufficiently able to work with clients. But prior to that, I started working with people who had physical disabilities of one sort or another, and everybody was telling me that whatever I was doing was healing them. And I really didn't know what I was doing, but I think I had some sense for it, which I think might have come from being able to understand nonverbal body language because of my training as an art therapist. So I just recently started introducing this with patients in the clinic. You would probably need at least 45 minutes to an hour for the yoga, and then flow into the art therapy, because I don't think that you should do the art therapy first, because you want to relax the body and the mind so that what comes out will be more unconscious and get to the root of what a person's working on. And explain it correctly. I think that if you start with the physical component of pranayama, which is deep breathing and regulation, some meditation, and then you go all the way through whatever poses you're using into shavasana, which is, by the way, the end pose where you lie prone and your eyes are relaxed and you're covered up with a blanket. That is the most difficult pose to do. When one goes into that state, you really go into a different meditative state than you do without doing some form of relaxation. And if you were to flow from that into the art therapy process, then what happens is you're really connecting to the unconscious, because stuff is bubbling up while you're in shavasana and your body is relaxed and you're literally exhausted from the poses, so your guard goes down naturally. When I worked with these supposed sisters that had suffered from bereavement due to their father's death, one of the poses that I had them do is Paschimottanasana. Basically, it was to take their legs and hold them and go down as far as one can, like that. And the reason is that you fold into yourself. You actually fold in and you get in touch with the depression rather than ignore it. And then if you hold that pose, you can contain yourself and you can contain the depression within doing that. So for example, that was a specific pose that I decided to use with the sisters in order for them to get in touch with that. Other poses I did with them, which was like Trikonasana, which is just the reverse, was sort of opening them up, you know, and they're reaching up to the sky and they're down here and they're opening up their whole chest. So that's a reverse mentality when you're trying to get somebody to open as opposed to close. So I was trying to work with both ends of the spectrum in order to get them to be less depressed, but also to allow for the depression. I think that yoga and mandalas, what they have in common is the circle, and that yoga is about centering yourself. Mandalas are about going to the center and then coming back out. So the way I see it is it's a marriage between the two. It's what we do in yoga. I don't think there's anybody on the planet who cannot benefit from it. And even if you're disabled, even if you're missing a leg, even if you're missing an arm, you can use props to accommodate. I can't think of one person on the planet who would benefit from it.